Okay, this is our interprofessional collaboration PowerPoint. All right, so this is our patient, Lindsay Merrill. Some important things to note about her is that she is a type 1 diabetic. She is bulimic, and her chief complaint is that she has a chipped front tooth. She is on medications, including diet pills. This is her hard tissue and perio chart. She has generalized erosion and chipped incisal edge on number 9 and 25. These are her assessment findings from today. One thing to note is that we did find a hole at the apex lingually of number 24. And that's possibly due to her tongue ring being there. These are her radiographs that we took today. It was a full mouth series and it was found just a generalized slight bone loss. And these are her intraoral photos that you can see the holder and her tongue ring. All right, so the treatment alterations for her is that you want to monitor vitals every appointment due to her meds, obtain an A1C and glucose level, and then watch teeth for decay and sensitivity from purging. And our dental hygiene diagnosis is that she has generalized slight periodontitis with localized moderate periodontitis. So this is our treatment plan for Lindsay. We decided that we would do a periodontal debridement in all 4 quadrants, and then have a 4 to 6 week reval follow-up with fluoride treatment because of her bulimia. Her teeth are more susceptible to caries, and give her some good oral hygiene. And the oral hygiene that we would give her is we would want to educate her about her current condition of the diabetes and to tell her the importance of good oral hygiene because it really plays a role with the diabetes. We would want to help her with her current condition of bulimia. She had stated that she wanted to get help for it. So give her some materials to find help or to refer her also. And then we wanted to educate her on how to properly take care of her gums and teeth with like the Bass method of brushing, flossing, and then helping her understand that regular dental cleanings are something that she will need with her condition of diabetes. And we also wanted to talk to her kind of about her tongue ring. It is kind of causing a little bit of problems in her oral cavity. So we want to just show her the pros and cons with her and get her, point of view on it as well.
All right, the healthcare provider that we chose was a general practice doctor. So we interviewed Dr. Callahan. And so at first we just asked him some general questions about how he felt about interpersonal collaboration and how he feels how his patients are affected by their oral health. And he said that he thinks interpersonal collaboration is super important because as a family practice doctor, he's like the center person who really gets everything coordinated for his patients and refers them out to a lot of different specialists. He also says that he doesn't totally always think about the patient's oral health. But he does know that if they're physically unhealthy, that can really affect their oral health if they can't brush their teeth, or if they're mentally unhealthy, they won't really think about brushing their teeth. So he does know that it does play a big part in affecting the oral cavity and oral health, but he just doesn't necessarily think about it all the time, maybe like he should. And then we just asked him more questions about how he thinks, how it affects his oral health, their patient's oral health. And he says that, again, he doesn't think about their oral health when it's good, only when it's bad. A lot of his patients come in and they have medical insurance, but they don't have dental insurance. So instead of going to their dentist, if they have a lot of oral health problems, they'll come to him. So because he's not a specialist, he will most likely just refer them to a dentist or kind of see what the systemic problems are with what's happening in the patient's oral cavity. And then he doesn't even really ask his patients about their oral health. He asks them a lot of different questions every time. It's called like a review of systems. But within all those questions, there's no questions about how they're feeling about the oral health right now. And then we were able to show him our case study of our patient. And the one main goal he said for her treatment is he really emphasized trying to help her with her bulimia because he knows that is a very hard thing to overcome. So he thought that was like one of the most important things for this patient is to refer her out to a specialist that will help her with her eating disorder. And then he was really worried about her because she's a diabetic, and then she's also taking diet pills that can really affect her heart rate. And if she's bulimic, when she's diabetic, she'll be taking insulin for her diabetes and then throwing it up. So it can really get her diabetes really uncontrolled. So he was pointed that out as something that is what he would really focus on for her treatment. So just um, he would work with other healthcare professionals like an endocrinologist for diabetes and a professional for her eating disorder. And then he said that he also would send her to a dentist because that overall was her chief complaint was the broken tooth. So he would refer her to a dentist for that. And then we were able to kind of tell him her dental history. And he didn't really change his answer that much because he kind of already said that yes, he would send her to a dentist. And he would just make sure the dentist was aware that she is diabetic and bulimic, and just hopefully he would already get her off of those diet pills, but just warn him about that too. And then he does know that after we kind of explained to him about her bone loss and gum loss, so he did kind of emphasize that it would be important for the dentist to kind of get that under control so it doesn't get worse. But he said overall, as a family doctor, his most important worries would be the bulimia and the diabetes and just getting that under control. And then his first thought would just be to refer her out to all the specialists that could help her with that.
Thanks. This whole time.